Hello, I'm Mary Major. Welcome to Your Medicines and You, AARP's campaign to help us learn to manage our medications. Many people take prescription drugs regularly. Most folks over age 50 take an average of 4 prescription drugs a day. Joining me is Dr. Bill Thomas, a geriatrician and expert on helping people over 50 better manage their health. And welcome, Dr. Thomas.
Glad to be with you, Mary.
It's so great to have you here. So much to talk about. Trusting the doctor, asking questions, and one of the key things is people need to know a lot more about their medications. This is about empowerment.
Oh, yeah.
You know, Dr. Thomas, all of us have always believed that doctor knows best, but that's changing. How so?
Well, old TV sitcoms aside, Dr. Kildare went off the air in 1964. And since then, we've been creating a new approach to medicine, and it's now a partnership between doctors and patients. And as a physician, I'm always delighted when a patient arrives to see me well prepared. I mean, the time we have together is actually very short, a very limited amount of time. So the doctor and the patient both need to work hard to make that time really worthwhile. So studying up on your condition, on the medications you're taking, and becoming an expert and asking questions in that exam room with your doctor, those are some of the really important things that you can do to improve the quality of your health care.
And something you just mentioned, be prepared. What exactly should they take with them to the doctor's visit?
Well, I think first, it's really important that every patient keep a list of medications. The medicines you're taking, and those are the prescription drugs, but also the vitamins, herbal supplements, dietary supplements, everything that comes in a bottle in a pill form, and even lotions and creams that you're using for medicinal purposes. You need a complete list so that when you are in conversation with your doctor, that list can be right out on the table. You know, a lot of people assume, and I think unfortunately, they assume that your doctor and your hospital have a complete and up-to-date list of everything you're taking. That's almost never the case.
You should also list supplements, herbal supplements, vitamins?
Certain vitamins can interact with certain medications. Certain dietary supplements can interfere with the absorption of certain medicines. There are changes in the body and drug interactions that can result from very innocent-seeming things. And if there's a chance of interaction, you should know about it.
AARP has developed a form you can use for these important conversations with your doctor. It's called a personal medication record and will help you organize the information we just talked about.
And who should get this list besides your doctor?
Well, you should keep it with you, and anytime you have any contact with the healthcare system, you should take that list with you so that in the emergency room, if you go to see a specialist or a consultant, lay it right on the table. Yeah.
What about giving one to your loved ones and about the pharmacist?
Pharmacists, I think, are an important, incredibly valuable part of our healthcare system. And I know that people can save money by buying drugs online, and I know that you can shop around and comparison shop for low prices. But I think it's really the best and the safest thing to build a relationship with a pharmacist who knows you, a single pharmacy where you get all your medicines. But there is a really kind of special and fun thing. It's very worthwhile you can do, especially if you take quite a few different medicines. It's called a brown bag drug evaluation. Set aside some time. You can make an appointment either with a pharmacist or your doctor. You go through your house with a big brown shopping bag and put all of the pills and lotions and creams and vitamins and herbs and supplements, everything goes into the bag. And you sit down with the pharmacist or the doctor and pull everything out of the bag and make sure that you're only taking the medicines you need now. And I cannot emphasize enough, too many medicines is more dangerous than too few. And this brown bag drug evaluation really helps people get to the right number of medicines for them.
What questions should people ask their doctor and also their pharmacist, particularly about interactions or reactions to different medications?
You don't have to be an expert on 150 medicines. You have to be an expert on the medicines you take. You need to understand what the drug interactions are, how they get along with other drugs in your stomach. You need to understand what the side effects could be, and to be alert for those side effects, because your doctor is not with you 24 hours a day, 7 days a week. You are the expert in your own health. And so becoming an expert in these medicines can help protect you from injury and potentially serious illness.
Another thing is cost. I think we hear about this all the time with prescription drug costs and seniors, particularly right now. There's another aspect of being a good medication manager, really, and it is making wise choices, such as watching the cost of your medication.
You know, this is America, and in America, we automatically believe that newer is better. I mean, who would want to buy a computer from, 1989? New car, new cell phone. Newer is better. But that's not always true when it comes to prescription drugs. There are many studies that have been done that show that sometimes older medicines can be more effective and certainly less costly than new drugs. So why did the doctor want to push the new drug out there? Why do patients sometimes come in saying, "Doctor, I want this brand new drug"? And the reason is our government has loosened restrictions on direct-to-consumer advertising, and the drugs that have the big advertising budgets behind them are the new agents. So it makes it seem like they're better necessarily than the old drugs, and that's not always the case. In fact, I have a saying for my patients. Sometimes the tried and true is best. So rather than looking at drugs as the new drug and the old drug, old reliable. Old reliable can really do the job for you sometimes. And it can cost a lot less money. And there's another big advantage to old reliable. It's been on the market for 6 or 7 or 8 years. Millions of patients have taken it. And therefore, you can be confident that you're not going to wake up one morning and open the newspaper and go, whoa, some big drug recall, or it's being pulled off the market, and so on and so forth. It's actually, ironically, more expensive and riskier to take a new drug than an old drug. So what I would advise to people is, when you're sitting and talking with your doctor, ask the question, is there an older, more established medicine that I can take that'll work as well for me? And listen to the answer, and work with your doctor to find the right medicine, and it's not always the latest medicine.